addition to treating patients in my office, I also perform chiropractic independent medical exams as well as peer-to-peer medical record reviews. Now, what are those? Medical record reviews are when a doctor of one specialty, chiropractic in this case, reviews the medical records from another doctor's office of the same specialty. So you look at what were the complaints of the patient when they came in, you looked at the exam that was performed on the initial date, you looked at the treatments that were provided, the treatment plan, and the treatment goals. You also look at the billing forms. So you see what was billed, how much was billed, and if that corresponds with what the medical records show. You then write a report afterwards, just saying, was this medically necessary? Was it not medically necessary? Was it up to standards of care? Was it not up to standards of care? Was what was billed what was in the notes, right? Because sometimes it isn't. Sometimes the notes say, that exercises were done, but instead of billing exercises, they bill, let's say, massage or neuromuscular reeducation or some other thing that doesn't actually correspond to the things that were done that day. The purpose of peer reviews, some doctors hate peer reviews because they feel like they're getting nitpicked and that you're working for the insurance companies, but you're not. You're independent. Most of the time, I don't know who the doctor is. I don't know who the insurance company is. I'm completely independent. What you're looking for is to see, is the doctor giving good care? Is it medically necessary care? And is it in line with clinical practice guidelines for the standards of care? Oftentimes it is. Most doctors do the right things. So I think it's important to do these because then it helps the doctor tell the insurance company in the end when they read my report, yes, this was medically necessary. This was appropriate. This was good care. Pay this doctor for their services. On the other hand, if it's one of the doctors that is not doing things the right way, it helps the insurance company to not pay for things that were not medically necessary. And because when they're paying for things that they shouldn't have paid for, that in the end drives up premiums for everyone else. So it's not, I don't always stop care. I don't always say, no to this or no to that or yes to this or yes to that, right? It's case by case. I would say it's almost 50-50 because again, most doctors do things the right way. It is important to weed out the ones who aren't, and it is important to let insurance companies know the ones who are doing it right. Usually once I write a couple of reports for a doctor doing it right, I don't get more cases from them because the insurance companies know that doctor's doing it fine. We're not going to go through this with them anymore. So there is a purpose for it that can help both sides. Now, an independent medical exam is similar to a medical record review because you are reviewing the records, but you're also doing an in-person examination of the patient. So the patient will come to my office, they'll sit down, I'll take their history over what happened, whether it was a car accident or a work injury or slip and fall, whatever the injury was. Then we'll go through an exam. We go through neurological testing, muscle strength, sensation testing, deep tendon reflexes, balance testing. Then we go over range of motion, orthopedic tests, palpation, feeling how the muscles are feeling, how the joints are moving. And then when I'm done with that, the patient can leave. I will formulate a diagnosis. And then I will finish reviewing all of the records and I write a report, same thing, where, this is where the patient is right now. Their pain levels are here today. Here's where their pain levels were when they started care with this other doctor. Here's what they might need going forward. Or, hey, they're pain-free, they're fine, or they're still in a lot of pain. This treatment's not working. They need a different type of provider. It can go any way, any of those ways. The treatment's not working. Not everybody's a chiropractic patient, right? Chiropractic can work for most things and most people get better, in a relatively specified amount of time, right? But sometimes they don't. Sometimes they get worse. And you can't just keep doing the exact same treatment over and over and over and over again when they're not showing improvement, right? You either have to change your treatment or send them to a different provider. Maybe they need an orthopedist, maybe they need a neurologist, maybe they need pain management, right? Who knows? Maybe they need a different form of physical therapy. But you have to be careful over treating. You have to be careful making sure that you're billing things that are appropriate for the condition and that you're actually performing, right? Independent medical exams and medical record reviews are beneficial to all parties. I know a lot of doctors hate them, but to be honest, the doctors that hate them that much are the ones who are doing it wrong. Right? If you don't like someone saying what you're doing wrong and that this wasn't medically necessary, stop doing it, right? The insurance companies don't like it when I say that they need more care. This care was appropriate, give them more. but the doctor's doing it right. So it is what it is, and that's what keeps me independent. If you do things the right way, you're not going to get your care denied, right? Get your patients moving, get them adjusted, give them home exercise program, do these things properly, in a reasonable amount of time, and you're not going to get, the treatment cut off. But if you're doing 8 weeks of passive therapy and the patient's pain levels have gone from an 8 to a 7, you're not helping that patient, right? So the whole goal is to help the patient get better as fast as we can get them better, not drag it out for a year. If you can get the patient better in 6 weeks or 8 weeks, right? 4 weeks, why don't you do that, right? Let's get these patients better as quickly as we can so they can get on with their lives and get back to their pre-accident status. So that is my talk on independent medical exams and medical record reviews for today. I will come back with some of the codes that I see that are completely inappropriate, at least in chiropractic cases and sometimes in any case. So look forward to those. Thanks.